May is National Mental Health Awareness Month, and now more than ever, we are learning so much more about the current needs, prevention, and treatment to aid during this time of mental health crisis. Joining us today is Dr. Janice D and Dr. Erin Scherder, who both play a big role in the MUSC Boeing Center for Children's Health and Wellness. Thank you both so much for joining us today.
Thank you, Taylor.
And now, Dr. Key, I'll start with you. In October of 2021, a state of emergency was declared in children's mental health. What led it to being deemed as a state of emergency?
Well, several authoritative groups, including the American Academy of Pediatrics and the Surgeon General, noticed a tremendous increase in mental health problems amongst kids. It was already increasing before COVID, but all the impact and disruptions of COVID just caused a spike that we've never seen before.
I could imagine. And now, Dr. Scherder, what are some of the things that parents should look out for when wondering if their child could be going through some mental health problems?
There's many different signs of mental health concerns in children. Lots of times it's irritability, acting out in class, and we define mental health specifically in the schools as social, emotional, and behavioral health. So thinking socially how we interact with others, emotionally how we feel, and behaviorally how we act. So thinking of signs related to our social, emotional, and behavioral health that show up, parents can be aware of those signs and symptoms so that they can support their students overall.
So a lot of open communication and talking, I'm sure, is very crucial.
And let me just emphasize something that Erin just said. Depression in kids shows itself differently than depression in adults.
Yeah.
Adults, we express that we're sad, but kids appear angry. And so sometimes parents think they just have an acting out teenager who's withdrawing and spending more time alone and irritable. No matter what they say, they lose their temper. No, that might be a sign of depression.
Now, Dr. Key, kind of touching on the adults a little bit, I know that we do voice when we're sad. Is there anything else that we can look out for when maybe we need some help?
That's right. The number one way to prevent mental health problems in kids is to be sure we, the adults taking care of them, take good care of ourselves.
Very true.
And so signs of depression are feeling sad or feeling easily irritated for longer than about 6 weeks. Everybody can have a bad day, but if it persists. Also, lack of enjoyment. If you're just not enjoying the things that you used to enjoy, that's the second big sign of depression.
Now, Dr. Scherder, if a parent or caregiver was to notice that a child, they might be concerned that they are having mental health struggles, what would they do?
That's a really great question. The main resources, I believe, are the schools, because that's where children spend most of their time. So reaching out to school leaders, thinking of school counselors, school psychologists, administrators, someone within the school that can help support and help them find those resources available to them so that they can access them readily. There's lots of mental health supports in the schools. It's just making sure that we advocate for our children as well as ourselves when finding them.
Absolutely. And now, Dr. Key, what are some resources that parents can look at maybe online or videos that they can see to kind of help them maybe understand better?
Well, before you jump online, and there are many things online, I would encourage parents to go to their pediatrician or their primary care provider. We are all trained in evaluating and diagnosing mental health problems in kids and can help parents find the right resource for their child. But secondly, there are some really new, good online crisis tools, like the new 988 suicide hotline that's available nationally. It's available online, or you can just dial 988. And the National Alliance for Mental Illness, NAMI, has a 24/7 crisis line that adults or kids can call. It's more targeted towards adults and teens. And they have available peer counselors to talk it through and can give you ideas of resources in your own community.
We will put those resources below for you all, the NAMI and the 988 hotline. Dr. Key, Dr. Scherder, thank you so much for joining us and talking about such an important topic.
Thank you.
Absolutely. We are back after this.